Um, as he introduced, this is about how our faith communities are responding to mental health issues. One of the key things is COVID-19. We have 5 speakers tonight who have 5 to 10 minutes. I am warning you, I am timing you. So you'll hear something go off if you go over 10 minutes, okay? So that's so that we can all keep in. If anyone has questions they would like to ask, there is the chat option. You can find it at the bottom of your Zoom screen. Hit it, write your question in, and if we have time afterwards, we can address those. So to begin with, we have Jasmine Sodhi, who's of the Sikh community. Jasmine, would you please bring us your insights?
Oh yeah, thank you. Yeah, sorry, I didn't expect to be first, but very happy to be. So yeah, just in terms of obviously during these COVID times and lockdown, I've been thinking about what sort of support's been there. And in the Sikh community in Lincolnshire, there's only really a handful of families. So as with all sorts of communities, the use of the internet's been really helpful. So a YouTube channel called The Basics of Sikhi have been doing a daily Hukum Nama, particularly during the first lockdown, which is basically a reading of a verse of the Guru Granth Sahib, randomly opened, and then they do a discourse on that. So it's an ability to be able to feel connected, really, in a way that in Lincolnshire, I don't think we've been able to prior to this, because there isn't a Sikh place of worship in Lincolnshire and you've got to travel out. So that's been really, really helpful to have that sort of virtual space. And then, of course, as places of worship did open up, we've got to travel to Leicester or Nottingham or Scunthorpe, but I'm also aware that people are sometimes now reluctant to do that, particularly if they're looking after somebody or have got somebody in the household that's extremely clinically vulnerable, or just concerned about track and trace and then having to self-isolate if they were to visit. So I know that's sort of restricting it as well. But the Midlands Langar Seva service, so Langar is something that was started over 550 years ago by the first Guru of the Sikhs, Guru Nanak Dev Ji, which is free food, and they've continued to provide free food to the homeless or anyone in food poverty, really, in the Midlands. They don't have a presence in Lincolnshire, but they certainly do in Nottingham. So that's been going on as well. And I've just been checking in periodically with the Sikh families that I know in Lincolnshire, just to see how they are in terms of their health and well-being. There is also a Sikh mental health helpline that's advertised in the Gurdwaras, and something I'm sort of just beginning to be aware of is that unless you go and visit those places and they're accessible to you, you're not necessarily going to know about these resources. And it's about just really thinking through how we can share what's available, specifically for the Sikh community, but also wider, and maybe linking those into international and then national days like World Mental Health Day. So something to think about for next year, because that takes place in October. But then just to talk a little bit from a Sikh perspective. So from a Sikh perspective, it's really that we are all suffering from a dis-ease. So, and Sikhi talks quite a lot about the mind and just being aware of what the mind is doing, and that the mind flutters and fluctuates all over the place. And particularly during these sort of challenging times, unprecedented times, the mind can tend to do that. So we bring our awareness to that present moment awareness, which is called hukum in Sikhi. It's that kind of present reality. So just touching in with that present reality, accepting what is here and how am I responding to that. And that can help with our kind of general everyday mental well-being. But I think also there is this need not to be judgmental, to accept, to approach it with understanding our own well-being and others' well-being as well. And that meditation, Naam Simran, it's called in Sikhi, can really help with that. Mindfulness awareness can also really help with that as well. And just accepting where we are without that judgment, and knowing that actually this too shall pass. So we don't try and hold on to it. It's that non-attachment to it, but allowing it to be. I'm also a yoga teacher, and pranayama, breath work can be really helpful for that as well, as can posture practice, exercise, physical activity, relaxation, chanting of mantras or mindfulness. can all help with those. But I think as well, it's just really acknowledging on that sort of quadrant of mental health, we all have mental well-being just as we have physical well-being. And it's really just about, okay, I'm, you know, someone may be diagnosed with a mental illness, but their mental health may be still quite good. Or actually, you might not have a diagnosis, but your mental health may not be so good. So it's recognizing those things as well, and those nuances also. And yeah, and it's also actually in Sikhi, they talks quite a lot about being in Jagdi Kala. So that means in elevated spirits. So am I being a bit more grouchy? Am I practicing gratefulness? Am I being kind to myself and to others? What is it that I need? What is it that my, you know, the people that I'm living with or interacting with, what do they need? And kindness is quite a big thing there, I think. So I don't know if I've gone over or whether I've still got time.
You still have 5 minutes.
Oh, I've still got 5 minutes. I was talking quite a bit there. Yeah, and it's really again in Sikhi, as in other sort of Eastern philosophies, you know, it's a philosophy from the East that the actual individual soul, the Atma, is part of that supreme soul, that Brahmatma, and this is a journey through life. So that when we are feeling dukh or dukkha, it's just facing that present reality as it is. And not having attachment to it, because sometimes it's that ego identity as well, which is called one of the 5 thieves in Sikhi. So is this something to do with my attachment, something to do with the way my life was and how I'm perceiving how life was before compared to how life is now? And do I want to hold on to that life? Whereas maybe if I let go a little bit, maybe let go of how things were and embrace a kind of new, it might be helpful. But I appreciate that's really challenging, because the rhetoric we tend to hear is about going back to a normal. When can we go back to normal, or what will the new normal be? And I think it's helpful sometimes to embrace those changes and just acknowledge where we are. So yeah, I think that's about all I need to say at this point.
Thank you.
First mention is that kind of labeling as well doesn't help, and the stigma around mental health, I don't think really helps people to access services that would be available.
Yeah.
Someone can see that you've got a physical ailment, that's okay, you can go and get medication for it. There tends to be empathy and sympathy for that, but often not so much around mental health. So I think that's something that you know, further work needs to be done really to address that. Thank you.
Thank you. Clive, are you ready to share with us from the Baha'i perspective?
I'm just one of the Baha'i community. But I should also probably explain, forgive me, that that I'm finding this quite difficult this evening. And I wish, because of that, I wish to, if it's possible, I'm going to say a short prayer and a little song that will help me feel better. And I'll explain a little bit later. So this is a prayer that has sustained me, and it's for all of you as well. And I feel it's sort of appropriate in a way for COVID. Oh God, refresh and gladden my spirit. Purify my heart. Illumine my mind. I lay all my affairs in thy hand. Thou art my guide and my refuge. I will no longer be full of anxiety, nor will I let trouble harass me. I will not dwell on the unpleasant things of life. O God, thou art more friend to me than I am to myself. I dedicate myself to thee. And this is for, perhaps, I'm sure it's all of our views, but it's a little song. Do not be content with showing friendship in words alone. Do not be content for showing friendship in words alone. Let your heart burn with loving kindness for all who may cross your path. Let your heart burn with loving kindness for all who may cross your path. Let your heart burn, let your heart burn with loving kindness for all who may cross your path. We started out COVID by my wife and I going to the Baha'i World Center in Israel for a pilgrimage right at the beginning in Haifa, Israel. And we came back and suddenly we heard, this was in February, that were 500 Chinese in the next terminus. And so this Israeli soldier lady, about 20, insisted we all wore purple masks, and we became like the blue mask. And everybody accepted except one Orthodox family. And so we came back into COVID, and we'd lost our community, but in a sense of not being able to hold them and be with them. And then what we found out about Zoom, and we Zoomed across the world, really, in an extraordinary way, which were meeting friends, Baha'is from Egypt, from Mongolia, from India, from America, from the islands. And that was extraordinary. And our own community was picking up with Zoom. And then I want to say, and then what happened is that Jill and I got very sick. For a period of months. We were really absolutely clobbered, so that we couldn't make a phone call. The only people who we were in touch with were our children who were phoning us, and the Baha'i community found quite soon that we were sort of living from paracetamol, from one paracetamol to another, feeling terrible. And we were both diagnosed with post-COVID, which went on a long time. And during that time, I want to share something now without going too much about that, because this is about community. I want to share something I found this morning. I am a man who believes that as men, we should be allowed to be more vulnerable and open with our feelings and emotions. I believe that we must redefine masculinity. I am insecure. I second guess myself constantly. I judge myself more than I would like to admit. I am weak more than I am strong. I'm scared of the idea of death, but I'm also a believer that this life is just the beginning. I believe that I am not separate from anything and that I am one with everything. I am no better or worse than anyone else. I am not more important than anyone else. I'm just one tiny drop in a massive ocean. I am just one flower in a beautiful and diverse garden. I am trying. I am doing the best I can. I am flawed. I am a work in progress. I am love. I am human. And so that experience of going right out into the big wide world, so to answer the question that ever since the lockdown, my wife and I have said I've hardly seen our children, our 4 grandchildren, and our beloved Baha'i community. Just to explain, there's no form of priesthood in the Baha'i community, and yet our community have supported each other in many ways, both practically and spiritually. There's a spiritual assembly in Lincoln of 9 people. We couldn't take part for a whole period of time, and so others took over. It just so happens my wife is secretary and I'm chair, that's all, but it's only for 1 year. We're elected differently. And we have, these 9 adults have carried the community forward. Similar things to yourselves, delivery of food to friends, medicine. I'm saying we were the recipients of this because we couldn't go out. We were pretty well, as I said, the English word clobbered. The one thing I couldn't believe about it is how it came in great waves. It was not a continual thing. And it made you want to cry. That's all I could say. And then beg for God's help, really. And it's interesting because for a period then we discovered the power of walking and praying, which I had known about before, but it's very powerful. And even the central figures in the Baha'i faith, the stories are full of walking and praying. And so we walked from the back door to the front door of our house, and we had something called the long healing prayer. But the friends across the county, the other extraordinary thing is, normally it was a really big job to go to the Baha'is of, let's say, Grimsby or Stamford or Grantham. But through Zoom, we were very close. And so medicine was in touch, and actually we have a program called a program of spiritual transformation that is skyrocketed. So after this period, we gradually came in to what the other friends were doing. Other communities have been supporting us. And so the first one, it's called Reflections on the Life of the Spirit, that many of the community did, which was all about prayer, about the next world, and moving on to the other books, as it were. Still having contact across the planet. How many minutes have I got now, John?
You have 2.
2, yeah. Yeah, well, we got a picture of our grandchildren over there. They drew great big pictures. And it's fascinating how it's unfolded. We go to, I've told Subhash, once we got out, we are like 1,000 times better than we were. But I feel that this COVID is a stepping stone. It is not, it is something to understand how infinitely connected we are. We are so connected that, that this sense of, there's obviously only one God, but we are so much one family, that COVID has brought down barriers. It opens up to the whole consciousness of the fact that we are all immigrants in this world. We are all just strangers in the night, as it were, but we are all these barriers that we put between us can unfold. So just like the next one down the road, I think is going to be big time climate change, that we have to take this on board and the very core of our communities to understand how we can be as one. God never wanted us to be separate. And so these things will come one after another, I believe. I mean, it says, a sociologist, friends of mine, Baha'i writings clearly point out that society is unraveling and we are losing a sense of community at the same time as individualism, materialism, and competitiveness needed to grow, continue to grow. We must recognize that mental health concerns are often related to public issues rather than private problems that we have. And in other words, not make them as a separate issue. We have to deal with a society that is not creating community.
Carol, would you share with us the work from the...
Yes, certainly. So sustenance, well, let's start by saying, I think I'm the only Brahma Kumari in Lincoln.
Okay.
We are spread worldwide, but I am a representative here. Sustenance for ourselves, we don't need, because our entire philosophy has been based right from the start on our mental, emotional, spiritual health. And so that is part and parcel of our spiritual growth. We've spent many years being prepared for such events as this. So right from the start, we have had stores in so that we were able to share with other people at times of crisis. We've kept these stores in our own private homes, in our centers and wherever. Spiritually, we've always had numerous channels online. So we provide spiritual support, teachings and talks, workshops of all kinds, and have done for many years now, ever since being online has been possible. So there are YouTube recordings and there are contact addresses and phone numbers so people can have personal connections with us. What's important for us is that we have been taught right from the start that we have to attain a stage where we are, this is the sustenance for other people. We are the ones who are to provide for others, and therefore we must become self-sufficient in this matter. We all have a dedicated meditation time first thing in the morning and in the evening. This we can do on our own, online, or in the past we would attend centers. I've been away from a centre for 20 odd years, and so I'm used to living on my own and having to sustain myself. That's not to say I didn't go to centres at all, but I would go perhaps once a month, once a fortnight if possible. And so our process is to share the knowledge that we have, which of course we do in classes and so forth, and people come and make a contact with us. I used to have a sign outside my house saying free meditation classes, free positive thinking classes, and so on. And people would then come and contact me and they would learn these processes. So this is very important as far as we're concerned. We've had quite a lot of experience with crises across the world. And if you remember the tsunami in the Far East, our members were able to supply food and support to people on their island where they happen to be, and keep order and in a very gentle way until help came. We had a similar situation in Australia when they had, Northern Australia had the earthquake, if you remember. And again, the centre there that was open was unharmed, and they welcomed local people to come, take shelter, share food, and to reassure them and so on until help came again. Similarly, there have been places where there have been floods and hurricanes and all kinds of things. And we've always seen ourselves as being there to provide assistance, support and help, emotionally as well as physically, but primarily spiritually. But whatever facilities we have are made available to the general public. So that's our focus. And I mean, we've had talks have expanded enormously online. So we've had webinars, we've had Zoom meetings, we've had YouTube talks and so forth from across the world. And very much like others have said, you know, they're literally from Africa, from Asia, from the Americas, from Australia, from all over the place. So it's been really lovely because we all know each other. We're all one family. We tend generally to meet once a year in India. So we know one another through that as it is. It's very much a family. We do have support, and our support is just the one Supreme Soul. So this is the only source of support that we use and we take. Obviously, if we had physical needs, well, there's always somebody from our group at the other end. But primarily, our focus is in providing for whoever happens to be. I've only recently moved here, literally. I came in the break between the two lockdowns, so I don't even know my neighbours. However, I have already got my garden going and had vegetables growing, and I've been able to plop some vegetables down on people's doorsteps, even though I don't know who they are. So, you know, we do aim to make it a literal help, not just something that as intangible as spreading good wishes, because at present, I mean, this particular week has been, we've been asked worldwide to combine for a 4-hour period each day for a meditation to send good vibrations, good wishes and love into the world. So this is the way in which we operate. Okay.
Okay.
Any questions?
Abdul, would you share with us what your faith community is doing?
Okay, thank you very much, John. And I'm really glad to be here. And thanks, Abash, for inviting me. And again, I'm just, I'm not the you know, like a leader or anything. I'm just like one of the part of that leader group, leadership team. So I would like to share something about this, especially on the COVID. First of all, you know, it is very kind of milestone, as Jill mentioned, that this COVID situation is really gave us a breaking point, and you know, gave us a point where we have to think and roll back ourselves, you know, because we were running around the world very fast. We are leaving everything about doing nothing. And as a Muslim believer, our belief that everything has come from God, right? So first of all, we are already prepared based on the Quran and based on the saying of Muhammad, peace be upon him. It's very clear that this pandemic is not new, right? It's happened in centuries before and before and before, and it's been covered quite thoroughly in the saying of Muhammad, peace be upon him, and also in the Quran, that how you're going to tackle with this kind of pandemic. So first and foremost principle is that we have to have firm belief in God, that God does everything. We should not be having any doubt about it. So for example, we always say, why this is happening, why this happened. First of all, we have firm belief, and also we have to have understanding that how we can tackle that. So we have two areas. One area is that how we can be connecting to the God and how we worship ourselves. That's our private worship. So mosque is there. So we have a very strong connection with the mosque. We pray 5 times a day, and every believer can't live with like Muslim is like a fish without a water if they don't go to mosque, right? So it's very hard time for Muslim not visiting mosque. But on the other hand, we are prepared because there's a saying of Muhammad, peace be upon him, is saying when the pandemic happened, you should not visit for other society or other community, just so that you don't cannot spread. And I'm glad that whatever kind of guidelines from the government guideline, the majority of guidelines are matching with our principles. Like for example, ablution, like making wudu, clean yourself 5 times a day, and covering your face, and all that. This we are quite used to that. So it's nothing new for us. So we are really compliant with the guidelines. So that's really good. But also on the other hand, we have a lot of misconception that if we don't go to mosque, we are really we can't survive. It's not the case. Muslims are aware private worship can be done in the home, no problem at all. We go to mosque for congregation purpose. So we have a multiple purpose going to the mosque. One is like a praying, worshiping Allah, but on the other hand, to meet the community and help each other and ask for for example, if somebody is suffering or somebody going through with mental health or kind of spiritual help they need, we always meet and greet and and always try to find the way and find the right professional through the mosque and get them connected. And I'm glad that I was part of the session yesterday with Stacy, running very good program around the Lincolnshire. Similar kind of service we do in a mosque every day, where people meet and greet and share their problems, and where we can find the right person to help. So that's one area where we have to always we always kind of meet and greet, but which is the really hard part. For that, to solutionize that, as other people are doing, we are running a lot of Zoom conferences programs, and a lot of workshops, meeting with with the community, and also like doing lectures with imam, with help of imam, and also community leaders coming on board, preparing everyone that you don't need to be worried about. We are currently in touch with the government, we're trying to open the mosque and all kind of like compliance things. We are always talking to the community and helping whatever we can. But I'm also working with the wider community. It's not about the Muslim community. I'm working with all within Lincolnshire County Council. We are running like a pencil bank food cook, a kind of service where all the community leaders and also community people come on board and share basically their issues and problems, and it's like remove the isolation basically. So that's the one area where I'm working. And most importantly, we as a mosque stand up that to run the food bank service, because we thought mosque is closed, but how we can utilize the mosque, and also how we can help the wider community, not just Muslim community. So we with the help of Paul and also work of Act Trust Church, so basically we work together and we set up a partnership and set up a food bank service. So thank God, since April, we have served more than 200 families. So every week we run a Saturday, run a food bank service. We have a visitor around 10 families per week on an average. And literally they have nothing to eat. They don't have nothing to live, and do no earning, nothing like that. So it's very amazing, to see that people coming. And mosque, as a mosque, we are able to help something and giving something out to the community. So that's really a kind of things we can do at the moment. So as a Muslim community, we are not very kind of 100% prepared, but when the situation comes, we know what to do, and we have got a lot of more channels coming on board, like working with other faith groups like Subhash and also other leaders, so that we can establish more services. And we are more preparing towards online. I think I will work with Carol as well, that will see what kind of other online platform we can utilize to provide more kind of services.
Our final presentation is from Mark. Will you share with us what the Quaker community is doing?
Yeah, I'm only on audio at the moment because it'll be a more stable performance if I only use audio rather than video. So I'm not a religious leader. Quakers don't have religious leaders. We have a very flat structure. I thought I'd just kind of run through what our community has done, but then look more widely at the big questions that I think have been posed by COVID in relation to society, community, mental well-being, and what we as faith communities can do in looking at the new normal, as it may be. So there are 120 Quakers in Lincolnshire, in the county, and there are 18,000 Quakers nationally in the UK. We, as with all places of worship, we had to close our meeting houses in March, and then we had to close them again 2 weeks ago. Our community has responded very quickly with Zoom, and we're able to hold our meetings for worship via Zoom. And we've been able, as with other faith communities, to connect with friends all around the world. And that's been quite exciting, challenging sometimes. Zoom isn't the easiest platform to use when it's busy. We are a small community of only 120 people, and we have managed, I think, very well to maintain communication, connection, pastoral care. We've developed, as other communities have, as much pastoral care as you can do down the phone. And I think it's deepened some levels of relationship, some levels of communication, because it's the only possibility we've had for pastoral care is on the phone. I think working out from our community's perspective, I think, and looking more widely at the question of Quakers and mental well-being, or faith and mental well-being, Quakers have actually had a very long involvement with mental illness. It was a Quaker in the 18th century who founded a hospital in York called the Retreat that pioneered the humane treatment of what was then known as the insane. That stemmed from a Quaker belief in the equality of all people, which is meant, and it's lived absolutely. What guides Quaker lives is the inner light. What we think is that there is that of God in everyone. And for me personally, that shapes the idea of community, of interrelatedness, of mutual responsibility, a unity. I think what people probably know Quakers best for is that our worship is silent waiting. So in a Quaker meeting, we gather as a community in silence and waiting for the inspiration of the Spirit to guide us to speak and to guide us individually and corporately. And that is actually quite easy to do by Zoom. That is our liturgy. It is a liturgy of silence and silent waiting. Silence is an important part of every Quaker's life. It's a gift. Possibly this year people, because of lockdown, have found silence to be overwhelming, of loneliness. Sometimes silence is calm and positive. But I think if you expand out of the idea of silence and think of mental well-being, there are other things that are silent. And I think COVID particularly has shown this. Stigma is silent. Suffering can be silent. Silent pain and turmoil can be silent. So that notion of silence prompts those deeper sort of questions. But I think what Quakerism teaches me is that silence is the start of something. It's the background to things. It can be a context for positive conversations, and silence is often the start of healing. It gives people a pause. And I think one of the most important aspects of an event like the one we're having today is that we can listen to the different perspectives on the same theme. One of the things that absolutely has struck me this year in my work is that COVID has prompted anew questions about the bigger idea of well-being. It's prompted those questions about what does it mean to be well? What is well-being? What is a good society? What is a well society? And I think it's really important as we're in the second lockdown to keep, as communities of faith, to keep putting that question to people. What is well-being? What do we now mean when we say we want to be well? We've all got a notion of what well-being is. It's positive, it's a physical health, it's an appropriate response to stress, it's happiness. And what I've heard a lot, and what we talk about a lot, is the new normal. We hear this all the time at the moment. What is the new normal? And I think that question of what is normal lies at the heart of how we as faith communities can respond to the COVID crisis. If we keep weaving through our spiritual lives, our social life, our orientation to action, what is normal? Weave that question through everything we do, we can start to reframe the future. We can start to have, on the basis of the social and cultural experience of COVID, we can look forward and we can say, the old normal didn't work. The old normal meant people were sick. The old normal was stressful. And lockdown has shown us how social, how action, cooperative action as a society lies at the heart of human flourishing. We have seen that so clearly with COVID, that it's only by working together, living together, that we're able to come out of this together. I think an interfaith community, an interfaith approach is a great opportunity to advocate for core values that will shape the new normal. The core values: love, care, community, thoughtfulness. Those values are shared across our faith traditions. They're shared across our faith tradition. We use different words for them, we use different language for them, but those things are at the heart of our faith experience. And we have to hold to that. We have to hold to one simple thing that COVID has taught us, that the most important, powerful value in society and in our culture is human life. That should be at the heart of the new normal. And I hope that's a Quaker insight that I can offer to other faith communities. Thank you.
Well, not so many questions as to how wonderful. Everyone, it's so lovely to be with you all. It's so much that we can learn from each other. And I think I assume wherever, the remit is Lincolnshire, is that correct? Or is that am I wrong there? Are we all Lincolnshirites, as it were? Is that?
Yeah, it is our primary remit, yes.
Well, I loved what everybody said. I feel that as an interfaith community, we have much to learn. I remember in the days when I used to go with Alan Deuce. Does anybody remember Alan Deuce here? He was the chaplain at the prison for many years, and Alan and I used to travel around to the other interfaith communities across the Midlands, and we were always staggered by the practical means where friends got together. I mean, across the communities. And I just think, and I've also been interfaith for many years ago, and we used to get all our children together when I used to live in the New Forest years ago. But, you know, because I was a teacher all my life, I just see that our children, of all of us, have a critical role to understand how to deal. And I don't think it's a new normal. I'm afraid to say that I think if we imagine that we're going to get a vaccine for this and the next thing is not going to come on the horizon, my feeling is that that we have many challenges. We have a very sick world at the moment, and division and separateness. You know, the sense. I'm going to quote something. It's a long question, I know, but I believe that we are all, I said before, a nation of immigrants. I believe that we went back far enough. We will realize that none of us come from a specific place. I believe that borders are man-made, that just because our parents and our grandparents settled in it doesn't give us the right to claim any land as our own. So our children have to have a different form of education, in my opinion. Even though I loved the education, I also taught in China a new system of looking at values, the thing that Marx was talking about. And I do know that the Leicester friends, because Alan and I went to Leicester, and we discovered that round all the houses of worship, there were gardeners, and the people gardened together. And it was a wonderful opportunity for them just to meet. And I've always felt that gardening, I was a founder member of Working Weekends on Organic Farms, which is called WOOF, working in the 60s. And I used to discover that when you were actually picking carrots, or you were, had a hard day in the field, you communicated in a different way than we are here. This is the problem with Zoom. It's all heads, isn't it? No one's showing their hearts. But once this first pandemic is over, our children need to be brought together and to grow things together and to have an experience together where they said, "Oh my God, we're so much the same, aren't we? We're the same as those kids who can't get into England in Dover. They're just the same, And it's on that level, I think the COVID has got to, in between the next pandemic, God knows what it would be, but we've done such damage to the environment and treated our animals so terribly that I think it's pretty well on the cards that other things are down the road, So those are my thoughts.
Yeah, thank you so much for this wonderful opportunity. It's really, really a big pleasure for me being here first in UK and at Lincoln University. So I am Kikuni Lucho. I'm an international student for the master's program in community development, social worker. So with Erasmus Mundo program. So I will be just here for one semester, and next semester I have to move in Denmark for my next semester. So I'm very, very excited and very, very happy to see how people are trying to care about each other, especially for this period of COVID-19. According to my experience, and when I was working back home, it's really, really very, very different. And when I came also here, I saw how people are trying to support each other. It's very, very different to my country. Maybe some of you have been in Africa. You know how life is very, very hard there. And especially in my country where I am from, we suffer a lot with Ebola, with the war, civil war, the poverty, and also the COVID come with locking down. So people are really, really, really suffering. So I am also the founder of the National Association of Social Worker in the DRC. And before I came, I was working in a small project of preventing COVID-19 in my country, and especially in the local area, because our government doesn't really take care of people. and it's for those local organizations who are trying to support people. And it was not really easy. And I thank some of my friends from here in the UK who are being supporting us for such a small project, sending some funds. And even last week, I had also some friends from here who supported to buy a lot of masks, because as you know, people are living in less than $1 per day in the DRC. So, and you don't have money to afford to get a mask, and you need it. It's a requirement, because if you don't wear a mask, the government will, the police will catch you and they will give you a fine. So life, it's become very hard to the people. So we were supporting them with food, with also education, health education, because a lot of them, they don't know how to read and to write. So we have to support them to show them the consequences of COVID, because a lot of people, they were thinking it's kind of just something which they come just to put in Africa, because we were also suffering with Ebola, and people, they didn't understand that, and we tried to explain them. So we need to take care. We need to support each other, but it was not really very easy to 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 come across and to convince people. And I try to learn a lot from what you are doing here and what you are doing here. It gave me a lot of skills, and I know that when I will be in touch with my colleagues who are working together in DRC, I will also share with them your experience of working and what you are doing with the community here. Maybe that also will increase some education, some skills, in order also to respond to this period of COVID-19. But I will also invite everyone to pray also for my community and to pray also for my country, because people are really suffering a lot. And maybe next time, I'm very open even to share some pictures, a video, and even to have more time to where I can talk more about my work experience in DRC.
Yeah. Hi, I'm Suresh from Lincoln. I'm originally from Sri Lanka. I have running from business from premier store from couple of store from Lincoln. First COVID time, we are work for the community for the hard work. We are the key worker, key liner. That period time we work for the council and other local community also. We supply for the food and other home delivery and everything. Most of the shop are closed. We work the community work for the part of the community. Then we have Sri Lankan family have 30 or 40 families living Lincoln. We talk about mental support and other social work also. Because of this pandemic time, our team is normally 21 staff work with the City of Lincoln Council first of lockdown period. They are 4 hours to do the job. Thus, we are very happy. I got the very experience also. Pandemic time, every shop is closed. They don't have food. They don't have home delivery. Elder people, they phone them because we try to do the home deliveries and everything. Then I'm so happy. I'm very happy to work this period time. I got a lot of experience. That's why my wisdom, everything, that's fine. I work for the still working for the key worker for the Lincoln community.
I think for me, just to mirror what sort of Clive said, it's just been really interesting, and it's been really helpful to just listen to others and be reminded about how connected we are actually, and also just get inspiration from others as well, because we're only a very small community, but also there are other small communities as well, and how they're interacting and still connecting with each other. So yeah, it's been really interesting, and also I think reassuring for me, because I'm not a leader in the Sikh community, so that was reassuring to hear others say something similar. So I found it really helpful. Thank you.
One thing for me is that while listening to everyone, it's very, very helpful, and I find it that how many things are common, even across the faith, across the way people are working. If we can list down everything by every person, we'll find 90% are the common goals, So we work as a team, if we can. This is what the beauty of interfaith work, as Mark mentioned, that we have to work together and keep sharing ideas. Sometimes you are doing something like Carol for many years. You're very active in online kind of education and workshop. We are not, and this is the idea where we're trying to get there. But I think working collaboration is very, very a great idea to be, I think, meet and greet and try to share the ideas and work together.
It's just been very interesting listening to all the different perspectives, because it's fascinating, because it's the same issue, but it's reached so many different groups of people, and everyone has their own quite different way of dealing with it, but also on the same premises of, as Mark was pointing out, that the different emphases that we all have of love and care and things, and it's really nice, quite refreshing to see that.
I too have appreciated this evening. And yes, I agree that there's a lot of commonality that I hear in both in response as well as in our care and our compassion for others. And I do believe that is one way that we can move forward, is how we show that compassion from each of our own faith perspectives, but we show compassion and we bring that sense of love, that sense of the divine love in. And I will say, I do find it fascinating that this pandemic hit in such a time of political upheaval as well. And we should, there may be a lot more warning that our earth is giving us about the way we not only treat each other, but how we treat the gift that the divine has given us. I thank you all for your thoughts, for your sharing, your questions, and let's keep this conversation going. And we need to support each other as well.